Okay, so I'm going to be explaining how to instruct a patient on breathing exercises. So the first thing I'm going to do is wash my hands and put on the proper infection control gear. It's going to be different for each patient, but you're going to be touching the patient, so you have to make sure you are protected. And then I'm going to introduce myself to the patient and explain the technique and the procedure and the therapy, just so they understand what we're doing and the benefit of it. And then I'm going to instruct the patient on pursed lip breathing. So I'm going to tell them to take a deep breath through their nose and then exhale with pursed lips through their mouth. And when they exhale, make sure it's a slow and steady exhale. And that comes in handy when you are instructing them for their abdominal breathing technique. So that's what you instruct them on next. And you have them lie down, and if it's their first time and it's their initial instruction, you want to, it's recommended that they're in a slight Trendelenburg position. And the therapist will place one hand on their epigastric region and another hand on their upper chest, and ask the patient to sniff or pant so that they can feel the movement of their diaphragm. And then instruct the patient to take a slow, deep breath through their mouth and exhale through the pursed lips as you had instructed them earlier, and apply firm pressure during the inspiration to make sure that it's being done correctly, that your hand should be pushed away by the abdominal protrusion. And their upper chest and their shoulders should expand, but they should not move upwards. And then I'm going to replace my hand with a book and have the patient perform the same technique, and eventually they will be able to perform this in more elevated positions based on their tolerance while sitting and walking. Then you're going to have the patient lie in bed and with their head fixed slightly, and then their thoracic spine straight. Their shoulders are going to be slightly rotated inward, and then their elbows, hips, and knees will be flexed. And so you're going to instruct patient to perform maneuvers, and while they're performing these maneuvers, the patient should close their eyes, take slow breaths, and relax for a count of 10 for each maneuver. So the maneuvers are: turn their head to the right and left, raise their head from the pillow, and then push their head into the pillow. Make a fist and then open the fists. And then bend their elbows, straighten their elbows, put their arms above their head, put them back at their sides, shrug their shoulders, raise their left leg and put it back down, raise their right leg, put it back down, spread their legs apart, move their legs back together, roll their knees in, roll their knees out, flex both ankles, and then relax both ankles. Curl their toes and then straighten their toes. And like I said, the patient should have their eyes closed, take slow breaths, try to relax, and each maneuver is for a count of 10. So for like the raising their limbs or their extremities, you're going to have them raise their arm, count to 10, lower it, count to 10, just as an example. So that's breathing exercises.